Well, the first case of monkeypox has been discovered in South Africa. The identified person is a 30-year-old Gauteng male with no travel history. This revelation was made by Health Minister Phaahla during a media briefing on the lifting of some of the coronavirus restrictions yesterday, which saw the suspension of wearing of masks in public. 2 years after the government came up with the regulation, the Department of Health says the Cabinet has approved to repeal the regulation that mandated the wearing of masks in public places. Phaahla also announced that the government is close to reaching a 22 million mark in vaccinations. We're joined on Zoom by Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Doctor, good to have you. Dr. Deputy Minister Dhlomo. I suppose that's the full title. Lovely to have you on the show. Thank you.
Good morning, Liam, and good morning to your viewers.
So an interesting day yesterday, you know, when you're so used to wearing something and then suddenly it's sort of said, well, you know, you don't have to wear it if you don't want to anymore. It got a lot of South Africans sort of confused, some smiling, some a bit nervous. Talk to us about the decision. Why did government decide to say, that's it, no more masks?
Yes, Leanne, when the National Disaster Act and regulations came to an end, we were concerned a bit as health and therefore needed a bit of a transition to move on into the space of not really abandoning everything else. But then we have been watching the space, and in the month of April, still really heavy in winter, we were really still having the Omicron, of course, a new variant, a sub-variant called BA4, B4 and B5. But we have been noticing middle of June, we have seriously reduced the number of people who are admitted, serious infections, ICU, all that has gone down. The positivity rate has gone down to between 5 and 7%. Now, that has shown a significant improvement in terms of the statistics. And number two, we are relatively happy with the number of our senior citizens who are vaccinated, sitting at above 70%, and 50 to 59 at 66%. So with the increasing of that and now seeing that we do not have really a new wave that has come in, the decision was therefore taken, consult the NCCC, consult with the MECs and provinces to say, can we maybe, these three regulations that were remaining, repeal them and move on and see what happens, because we think we're in a very positive space now. So that was the motivation, Leanne, to really repeal these three regulations that we had in place.
Yeah, obviously, this is something that we have seen a lot of other countries doing, and for quite some time, that mask mandate was dropped. But, you know, I sense that the department was very cautious in making this decision. But let's talk about the vaccination now, because many now thinking, well, great, I don't need to get vaccinated, and perhaps, you know, government will change its stance on vaccinations, and I will be able to do things, go to functions if it is the case or whatever it is, without proving vaccination certificates, and also perhaps work environments will not have to use this mandate now where they say you either are vaccinated or you don't work here. What's the policy with regard to vaccinations?
Leanne, over the past 2 weeks, I traveled to 2 countries whose vaccination status is 93%, the other one is 95%. They are not wearing masks anymore. And I was asking and following the rationale. And the reason is that if you are vaccinated to that level, you may still get COVID, but it will not be a complicating COVID. So let us err on the side of heavily vaccinated up to close to 90%, and then get an infection somehow, because even today, you do get people immunized against TB, and that they still get TB, but it's not a complicating one. So you are saying if you are vaccinated to your country to that level, there may still be COVID, but it will not complicate. So we are actually therefore saying, let us continue to vaccinate, push our percentages higher than what we do have now, especially the younger ones, because like I'm saying, the 50 and 50 years and above, they are way sitting above 66% and 70%. Then if we could all push our levels to that level, we will be comfortably without masks and be well vaccinated, and also from the national infection immunity, that will sit us at the very right space.
Yeah, indeed. So just one final question with regard to the change in these regulations. Is it up to, obviously now that government says it's not mandatory to wear masks, you may find that there are still businesses that want their employees to wear masks, and I mean, whether it be private companies, schools, businesses, pharmacies, hospitals, airlines. I mean, those are the kind of things now. I mean, flying in a South African aircraft that operates here, is this up to their discretion, or is it pretty much so, look, it's over, forget about it?
Yeah. Leanne, maybe to use an example of a hospital, there will be still some areas in our hospitals where masks will be worn. One is those patients who are having TB, and we work within their wards. So it will also be very advisable, and it's almost a policy for whoever is working in that ward to wear, because you cough and sneeze within that, and therefore the droplets of this tuberculosis will always be within that ward. So if I were to be in your party, Leanne, and there's many people, I would be doing it mainly to protect myself and have personal hygiene, because if you sneeze and cough in front of me, Leanne, I cannot guarantee that what you have will not come into me. So it will be more for that type of my own personal space rather than mandatory to wear it. Yes, we will probably encourage it to, in those maybe homes, elderly homes, in the areas where you would find a lot of people together who may be vulnerable, comorbidities, coming into a space with many people, that may still be advisable, but not mandatory at all in all those spaces.
All right. Let's move on to monkeypox now, because this is, we put one thing behind us and we have to now look to another. So let's give South Africans a little bit of background about it. And I think, I mean, it's prevalent in North and Central Africa, and the disease is more prevalent, as it's been said, to men having sex with other men. That's what we've been said. What else is known about it in terms of how it actually presents itself? First case discovered in South Africa. It's becoming more and more prevalent in Europe. I think 40 countries have now come to the party saying that they have got cases. Let's talk about this, and should we be worried?
Yes, indeed, you are correct, Leanne. It is prevalent in the Northern Africa and Central Africa. It's been there in those areas for more than 20 years. It is a very mild disease. It is also a viral infection. It spreads by, thank you very much, not like what we have had in COVID. It spreads by real close contact. I have to touch you, hug you, kiss you to really get it if you do have it. It shows itself by some blisters, lesions on the skin, usually on the hands, face, and the upper chest, upper body. And it's usually self-limiting. Yes, it may just come in with a bit of pain and itchiness, therefore maybe symptomatically treated that way. But it is not really, not really a very big disease to be concerned with. And you are correct, it has been detected on men who have sex with men. This one case that has been found in South Africa is not a person who has traveled, so they are still tracing the contacts. Could it be a friend who came from some part of the world visiting that family, that friend, and therefore left it? So it is probably something that we have, but I can actually say, I could be in that studio with you, Leanne. If I sit far away from you the whole day long without touching and hugging you, I may still go home without monkeypox as opposed to COVID-19, because I have to really get it because I have stretched my hand to you and you touch my hand with the blisters on it, and maybe then it gets into your hand. So we could really be able to control quite a lot of it if it is like personal hygiene. So it's like some of those things, Leanne, that me and you don't know. Smallpox that our grandmothers and mothers could tell us about. It's something that is coming in and recycling itself in that way.
Yeah. So the gentleman that has been diagnosed, I imagine he's isolating. I know that you are doing contact tracing. What is the isolation period that we have decided on? Or is that still something that, because it's the first case, we're a little bit sort of nervous and not sure how to deal with this?
Yeah, no, the scientists did not teach me that last night because it's a new information. But I would imagine it would be something like when you see the child at school with a chicken pox, you say, please go home, be there for about a week, and you isolate smallpox and all those. I would imagine it is anything within a week or so, but I don't have the correct information on that for now.
All right, okay, but it is something that people must be aware of. It is something that you need to look for the signs, and if you are feeling it, that's the way it is. I know that the World Health Organization yesterday actually convened to consider if the spiraling outbreak of monkeypox warrants being declared a global emergency. And there's a lot of critics as well out there saying, you know, this has been in Africa for a very, very long time. Now suddenly that it hits the US and Europe, now there's talk about it. And once again, the inequalities are being shown, and how if it does hit those worlds, then it's an issue. If it's here in Africa, no one really cares. I mean, surely this must really, in a way, infuriate African governments.
That is why, Leanne, there is a very strong talk that if you don't prioritize yourself as Africa, you'll probably never get to be prioritized by anyone. So let's look inwardly and develop, including drugs, including vaccines and all that to really do, because you saw with COVID, when there's scarce resources and scarce vaccines, those who are really moneyed, they jump the queue and they are number one. And therefore, Africa is actually up to 10% vaccinated to date because they were not able to compete with those who had money. So you are correct. Maybe now, because it is worrying those who are moneyed, then it becomes a priority of the world. And if it is not really worrying them, it's fine. You can just make those suffer and stay with it. So it is still that health apartheid that we see in the world.
Deputy Minister, on a very different issue, but an issue that is at the centre of all of this, and I just have to ask you this question: the developments surrounding the events of Dr. Tim Meyer. He, of course, is a paediatrician who has now been reinstated after he was suspended earlier for speaking against the appalling conditions he works under at Rahima Moosa Mother and Child Hospital. So an open letter was written to the department. I'm hoping you read it. There was the suspension, then he was reinstated, then there was another disciplinary case against him, basically raising very familiar problems about the condition, if not only Rahima Moosa, but very common in the health sector throughout the country, that some of the deaths can be avoided, but that filth and water challenges are causing spreads of viruses, which is a real worry. Talk to us about this. Why suspend a man who's speaking out, desperately trying to find help, and then the reasons for his reinstatement, but then allegations after his reinstatement, victimization by officials against him. Talk to us about this.
Yeah, if the position of the minister in this regard was that if the doctor was really raising bizarre things that are not there, things that have never been founded, then you probably would have had an issue. But he's raising things that are there, he's raising challenges that are affecting his, these are his tools of trade to really give in the best that he can to his patients. Now, why would you actually find fault? Because obviously, that was not his pot of call. There probably has been many areas where he has raised these issues. What has been the issue? So rather, the minister, which I know is busy with, is looking into why were these things left unattended? And now, at the tail end, when this doctor raises it and ventilates it at that level, it becomes an issue. When things have been raised inwardly, inside, in the management, in the hospital, have not been attended to. So, look, some of it comes a bit late to the minister, but he has taken a very keen interest, and we are looking into that matter, and probably we are not bringing it. But we are saying, rather than shoot this messenger, where are the people that have been receiving the message in this regard?
Well, I really would love to have a full conversation with the minister about this, but we don't have time. But just, one raises that question: why was he suspended in the first place when he's speaking about the lived experiences of what he does as a doctor and how patients are treated, and then gets suspended for that? That's alarm bells ringing all over the place, that we are trying to hide the real situation, whereas the truth must be spoken. So, but he has been reinstated, but there is still a big movement behind him. But Deputy Minister of Health, I'm not going to engage you more on that. We have to get into our news bulletin. There was a lot to speak about. Thanks for your time, and thanks so much for talking to us. Dr. Sibongiseni Dhlomo talking to us about a range of issues, masks, monkeypox, and of course the whole Rahima Musa and the doctor suspension story there.